What's a sign you need to immediately go to the hospital? Losing the ability to see color in one or more eye, sign of major issue in brain. When you throw up and it looks like coffee grounds. I had a headache for a week and was getting confused at work. 2 brain tumors and hydrocephalus led to immediate intake. You took a new medicine and your throat is closing up. Anaphylaxis can kill you. The worst headache of your life, which came on very quickly. Also known as a thunderclap headache. Even with no other symptoms, this needs to be looked at immediately. Could be any range of things, but what they're most concerned with is a ruptured aneurysm. Sudden hearing loss. The faster you get to the hospital, the better the chances of reversing it, statistically. In my case, I left it 2 weeks and I'm now living with tinnitus. Me, someone who has severe health anxiety, seeing this post, I should stay far away from that, reads every single comment. Edit. I really appreciate the awards, thanks. Edit 2. After reading up about this, I've realized that I was misinformed about which term to use and should have said somatic symptom disorder instead. I'm a doctor, so anytime phone rings I gotta go. For women on birth control, serious shortness of breath, as in a relatively healthy person being winded just walking to, from car, and unexplained pain in your legs, mainly inside thighs. Blood clots, embolisms. They can kill you very fast if they break loose and travel. It's now been about 24 hours and the foot that was purple is now sort of blackish in color. Suddenly getting a massive headache and you aren't prone to them. A friend's work colleague died at work, she had a headache, took a paracetamol then lied down in the fetal position. She started foaming from the mouth and by then it was too late. Brain aneurysm. Edit. Whoa, I never imagined such a response to this. I made this post and then went to bed and came back to almost 100 replies and PMs. Sorry for everyone's loss, looks like lots of others have been in the same boat as well. Signs of stroke. Face or mouth drooping. Arm weakness. Speech slurred. Time to call an ambulance. So think fast. If your pee is so dark that it looks like Guinness, go to the hospital immediately. The ABC of first aid is. A bone coming out of the body is a serious oopsie. When that wound you got on your foot by stepping on a rusty nail smells like rot. Haven't seen this one mentioned yet. If your newborn spits up bright green. Solid sign there is a major intestinal blockage, even without any other symptoms, and there is a small window to get that corrected before death. I have forgotten a lot from my stable class, but I do remember that. Is this thread making anyone else's body feel weird or is it just me? Pain in nuts. Always get that checked out. You can lose them if you don't. Torsions are real. Edit. Rip my inbox, holy shit. You were told 48 hours ago that you had gastroenteritis, stomach flu, and you did everything the doc said and not only don't you feel better, you feel worse. There are a lot of things it could be, but gastroenteritis is probably not it, and some of the other possibilities are potentially lethal. When my knee folded backwards was my sign. Wife had a pain in her shoulder and told me about it. Said it was uncomfortable but not a big deal. I told her to send her doctor a message. Went in for an appointment immediately. She had internal bleeding from an ectopic pregnancy and had about 12 ounces of blood floating around in her. If you have chest pain and especially if it's combined with sweating, nausea, vomiting, left arm pain, and/or a sense of impending doom. ETA, yes I know women present differently. Yes I know symptoms can vary by person. I was a paramedic. I definitely didn't expect this simple little post to blow up, so I apologize for not including it. Honestly, the following all together: lack of appetite, frequent urinating, vomiting, severe fatigue. Everyone thought my sister had the flu, but my mom took my sister to the hospital anyways. She had diabetic ketoacidosis. Her blood sugar was 717. She was almost in a coma. She was diagnosed with type 1 diabetes at 8 years old. ETA, I'm not a doctor, I only knew this because I witnessed my sister go through it. If you're experiencing these symptoms, please contact a doctor and get your blood sugar tested. If life gets good, really, really good, like too good, like you realize you're one of the most powerful people on the planet. Like you realize you're smarter than everyone else. And that you're God's favorite. And you know because he told you so. Himself. With his words. In your head. When you were seriously considering killing yourself. A feeling of impending doom, really, it's actually considered a clinical sign. And can indicate impending stroke, heart attack, or other things. Can also be a panic attack, but if it comes out of nowhere and isn't associated with a known anxiety disorder, don't be afraid to take it seriously. Bleeding that won't stop. Sudden onset abdominal pain and vomiting. Appendicitis doesn't always present as pain in the lower right quadrant. If it bursts, you're fucked. You were bit by an animal. Always assume it was rabid. If you don't get rabies treatment within something like 48 hours, you could cross the threshold into guaranteed death. Growing pain in your back near your kidney. Stones. Go to the hospital before the pain gets unbearable. Skin, white of the eyes turning yellow. This probably caused by accumulation of bilirubin in the blood, which can be caused by severe liver failure. If you are completely menopaused and you start bleeding like a period, it is not a period and you need to go to the hospital ASAP. Also, if you have been electrified but you feel fine, still go to the hospital because blood clots are no jokes. Welp, my appendix just exploded inside of me 3 days ago and my tell was that just standing or moving at all became excruciatingly painful. So if normal activities are causing pain, especially severe pain like I was feeling, maybe consider calling 911. Rectal bleeding. Several things can cause this, from hemorrhoids, all the way up to massive gastrointestinal hemorrhage. Some people won't go to the hospital out of shame and embarrassment in these cases and end up bleeding out in their house. Go to the hospital. Throwing up coffee grounds. For teenagers and young men, sharp pain in a testicle. Could be testicular torsion. If successfully treated within 6 hours, it is often good. However, if delayed for 12 or more hours, the testicle is typically not salvageable. About 40% of people require removal of the testicle. After they announced Bob Saget's cause of death, I saw this get discussed. So, if you had head trauma, even if you don't feel anything, go get immediate care. Apparently it can just go, omi wa mu shidiru, on you, just that simple. If you think something's infected, i.e. dog bite, other. Lost a toe after I stepped on a small nail at a house I was helping renovate, didn't think much of it until it started leaking pus a few days later because I didn't think much of it. Blue nails, pale face. I was young then and didn't know what's happening. Mom rushed me to hospital right away where I was immediately jabbed in the butt. Nurse said any later it would be too late. Contaminated food. Not so fun fact about hospitals. My fiancé doesn't have health insurance and just went recently for left flank pain. They ran some blood work and gave her morphine. She was out 4 hours later with the doctor saying musculoskeletal and told her to ice it. $8,000 bill. Edit. I'm sorry, $9,023.94. Me clicking on this post. Oh boy. Time to scare the shit out of myself. Can't wait. For women who are currently banging, a sharp pain in the tip of your shoulder. This is a major sign of an ectopic pregnancy and may be the start of internal bleeding. Very dark brown urine. Went into urgent care over 2 weeks ago because I had a rash, fever, and they told me it was probably a virus. The next day my urine had turned dark brown and I went to the because I knew it was a bad sign, trademark. Turns out I had sepsis and a life-threatening drug allergy from the antibiotic I was on. 2 surgeries and 9 days in the hospital later I'm alive because I recognized brown pee is bad. ITT, hypochondriacs freaking out. Uncontrollable bleeding. Unable to rouse, i.e. unconscious, not sleeping. Unable to breathe, skin changing color. Severed body part. Bone sticking out or obviously no longer supporting the body part. Suspected venomous bite, growing red or black ring. Suspected dangerous overdose of medication or alcohol. Persistent body aches and severe flu-like symptoms. Burns resulting in significant tissue damage. Foreign object lodged in body. Body temperature over 103. Sudden increase in floaties in one or both, and or something like light flashes in your eyes or eye. I'm to call the eye hospital I go to, but call an eye clinic or hospital or e-room and haul ass. Might be a retina detaching. Not a bad fix if they catch it in time. Very time critical. My eyes have a few issues, so pretty much every time I see my ophthalmologist he reminds me to call if I even suspect it is happening. Happened to my mother, caught in time, not a big deal. Super low blood pressure. Otherwise I would probably sit on the couch until I died. A red line heading towards your heart. It's blood poisoning, and will kill you. When your face starts to droop. A baby is coming out of you.